COVID-19 has made permanent changes in how we live our lives, some of which won't be known for months or years to come. But when it comes to healthcare, some of those changes are already coming to light.
In the final part of our 6-part series, Unity Point Health and Mercy One talk about the future of healthcare and what you might see the next time you visit the doctor.
We have permanently taken a little shift on our axis, and we will never be exactly what we were before. It's about communication, what worked well for the staff and the caregivers, and if they said, that didn't really work well, we would prefer this, or we think you should try this going forward. We've listened and made those adjustments. It's very situational. I don't think you can really throw a blanket on it and say this is the only way we're going to do it. Again, we've learned from our initial 4 to 5 week run with this. I think the single biggest piece of that is virtual medicine. This was something that was kind of on the cusp of being more of a day-to-day reality, but we have proven through this pandemic that you can receive medical care virtually with telemedicine, e-visits, connect with your provider, and still maintain your health and receive care through your providers.
I think we'll see a lot more telemedicine as well. It's something that we have inside the hospital we never really had before, so physicians could round on patients inside the hospital using a telemonitor. And then I think in the public too, if you probably yourself have gone out on the internet and maybe done, instead of going into the urgent care,
I do believe that the number of folks and the amount of foot traffic that we will allow through our care facilities will be much less in the future. We need to gain confidence, again, that people can come to their healthcare providers, clinics, surgery centers, hospitals, and it's safe. It's a safe environment.
I think the biggest lessons that we've learned are when to follow your heart and when to follow your head. And those are hard when you're on the front line. We heard some pretty difficult stories. It's very hard when you have 2 patients you're taking care of and you know somebody might not make it and you know another one will, and learning how to help those team members. I think the other lesson was that the work that we do every day, all year, is what got us through that. To be able to do what we do and just, we were there. Everybody was there.
It is very unpredictable, so we would not know on how much damage it can cause to patients. So there will be people walking around who would be carrying the virus and who would be sharing it, and they wouldn't know, nobody else would know that they have the virus. The only way to protect the other people from them is if they wear the mask. So
the next 6 months will be critical for all of us in this community. The most important thing that I can ask the community to do is please wear a mask. No matter where you are, wear that mask and social distance. We've shown that it works. We know that that works. So please do that. It's simple. We know it might feel inconvenient, but we can't stress enough how important that is to wear your mask.